Hello, everybody. I'm Tim Wenger, your host and moderator for this panel discussion. Welcome to Roswell Park Comprehensive Cancer Center's discussion about COVID-19, cancer, and what's next. In such a time of uncertainty, we hope this 30-minute special can shine a light on some of your most pressing questions and give you some peace of mind. I'm joined by several Roswell Park experts who will touch upon several topics as it relates to the pandemic and cancer care. We are joined now by Dr. Eunice Wang, the Chief of Leukemia Service at Roswell Park. Dr. Wang, thank you so much for your time. I know it's a busy time indeed.
Yes, thank you so much. What a pleasure for me to be here today to address you and your audience.
It really is a very challenging time, as you well know, on the front lines. One of the things that we hear the experts at Roswell Park say over and over again is that cancer cannot wait. Can you talk to that point for us?
Sure, I would be happy to discuss that. Unfortunately, in this time of great anxiety and panic and concern about potentially exposing patients to the risk of COVID infection, many of our individual patients have also been scared to continue their cancer care, whether that's fear of going outside, traveling to the center, being exposed to individuals in the parking lot or in our waiting rooms. We've certainly seen a decline in the number of patients that have been coming here. The concern is that because of the fear of the COVID-19, that patients who are benefiting from and having their cancer be controlled by chemotherapy and other interventions are not seeking out the appropriate care during this time. Cancer cannot wait. Your cancer cells are growing and proliferating, and the concern is that by delaying or omitting care during this period, that our patients will do themselves more harm than good.
So once a patient is inside the confines of Roswell Park, whether it's for an outpatient procedure or for an inpatient visit, what is being done to keep everybody safe, both patients and staff?
Well, cancer can't wait, and Roswell Park's mission is to continue to provide optimal, superb cancer care in any time, whether it be a good time or a difficult time as we are now. Our center has taken many precautions to be able to ensure the safety of our patients, as well as the safety of the employees and the frontline workers who come here every single day. From the minute you arrive at Roswell Park, we have instituted step-by-step precautions and protections for each one of our patients. There are separate entrances when you enter the facility for staff members versus patients. Every single individual coming into our center undergoes a screening questionnaire asking them if they have any symptoms, fever, cough, sore throat, that might be indicative of the COVID infection. Every individual is then undergoes a temperature check and is given a mask if they don't have one, to wear during their entire visit here and in interactions with every single individual here.
Dr. Wang, in the early stages of all of this, testing, simple COVID-19 testing was all of the rage and the discussion, but now everything seems to have shifted to antibodies. If you could kind of walk us through what those are, what the meaning of the antibody testing is.
Sure. So in this era, we are moving towards looking at many stages of the COVID infection. What the antibody test does is it doesn't measure necessarily an active infection, but it measures whether an individual person has been potentially exposed to the virus at some point. The antibodies that we make are our body's way of triggering specific immune responses to a specific organism or virus or bacteria. For example, if you have been exposed to the COVID-19 virus, your body, your immune cells will produce a protein, an antibody, specifically to prevent or to designate that your immune system has responded in some way to that infection. We are using antibody testing as a way to survey our population to see which individuals may have been exposed to it and which ones have not. Now, what's not certain right now is whether a patient or an individual that has a positive antibody test is really immune to the disease, i.e. whether they can fight off the disease or whether they cannot get it it again. The hypothesis is that patients that already have an immune response to the virus, much like the flu vaccine, would not have as severe a response or severe an infection if they were re-exposed. But whether that translates in terms of the COVID-19, we're not certain. There are also some limitations with the testing. Many of the antibody tests are not 100% foolproof. So just as with diagnostic COVID testing, about a third of individuals or potentially more who may actually have been exposed to the virus could still have negative antibody testing. And that may be because their bodies didn't achieve enough of immune response or make enough antibodies after exposure to the virus to have it detectable in our assays. Nevertheless, I think that the antibody testing gives us a measure of security. It allows us to determine the incidence and the prevalence of the disease in our patient population and in our employees, and gives us a way to sort of track or measure how widespread the disease is within certain patient populations and within the community at large. Now, in addition, I know many people are scared of the COVID-19 virus and they're scared to come in and get the medical care, but it is not 100% that those patients, if you have a cancer, that you have COVID-19. It is 100% true that if you have a cancer and you are not going to seek cancer care, that there are going to be detrimental consequences. So we would really encourage anybody who has a new cancer diagnosis or is undergoing cancer treatment to continue to be in contact with their personal oncologist here and at Roswell Park or elsewhere, and to go and seek out the necessary care that you need. We have no idea how long this pandemic is going to last, and it is impossible for us to say whether it'll be weeks or even months before we will be completely clear of this infectious threat. Your cancer, however, will not stop during COVID-19. What I would also like to highlight is that Roswell Park is not a COVID hospital. We do not have an emergency room. We are not a primary hospital caring for COVID patients. It is imperative and that these patients continue to come and seek us out. I can assure you that Roswell Park has taken every precaution to prevent and control and diagnose and treat COVID in our highly susceptible cancer patient population. I am confident that if you come into Roswell Park and you see the precautions that we are taking, that you will feel safe and protected while continuing your cancer care at our institute.
Dr. Wang, thank you so much for all you're doing, you and the team at Roswell. We appreciate it.
Thank you.
Dr. Eunice Wang, Chief of Leukemia Service at Roswell Park Comprehensive Cancer Center. This is COVID-19 Cancer and What is Next from Roswell Park Comprehensive Cancer Center.
These are challenging times, and staying safe at home is the right thing to do. But what if you're diagnosed with cancer? Cancer doesn't care about social distancing and won't wait until this crisis is over. Whether seeking a first appointment or currently receiving treatment, it's important to have a plan. Please call Roswell Park and let our doctors help you decide if you can wait or if you need immediate care. We're doing everything to keep Roswell Park a safe place to receive your cancer care.
It's COVID-19, Cancer, and What is Next from Roswell Park Comprehensive Cancer Center. In order to understand how coronavirus has progressed, we need to take a look back at its start. Joining me now is Dr. Bram Siegel. He is the chair of the Department of Internal Medicine and chief of infectious diseases at Roswell Park. Dr. Siegel, thank you for your time, a busy time, I know.
Happy to be with you.
Well, it really is a trying time for the medical industry and certainly a trying time at Roswell Park for patients and for staff. Now, inside the confines of Roswell Park, tell me about how you're working to keep people safe, patients and staff.
So the first thing we did is back before it ever hit our community, back in January and February is when we initiated planning. This was extensive planning involving infectious diseases, involving critical care, involving nursing, involving pharmacy, administration, senior leadership, basically all of the relevant stakeholders to plan basically for the worst. And the worst would have been that it was really significantly disrupting our ability to deliver cancer care. The worst never happened, but we needed to plan for it anyway at the level of people coming into Roswell with COVID, admissions. We needed to ensure that our employees were well trained. We needed to ensure that we had PPE. We needed to ensure the correct workflow. So if patients who are admitted, there's a least potential to expose others. We initiated screening fairly early. So if you come to Roswell and you go into the main lobby, you're going to be screened for any signs of infection. We have a mask policy where everybody, so I'm not wearing a mask, obviously, but I'm in my office. When in any of the patient care areas, we all wear masks. We provide masks to our patients as well. We set up physical distancing within our clinics. So it's kind of an all of the above approach. Early on, let's say sort of in mid to late March, what we needed to do is to intentionally downsize our clinical operations. So everyone who needed to have care, let's say people on chemotherapy, radiation, people who had urgent need for surgery, that was not interrupted. But for people who had more elective procedures, such as more elective surgeries that needed to be done, that was delayed. And when I say elective, it's not purely elective. These are patients who have cancer or who have a likelihood of having cancer. So our ability to sort of delay care is limited by the risk of the cancer. So what we needed to do is to come together and say, okay, so for a number of weeks, we ramped down on our clinical operations. Now we need to ramp up again because cancer isn't waiting, and we need to take care of our patients and deliver cancer care concurrently with community spread of COVID. That's the challenge we have.
Talk about the social distancing. There's a great deal of pressure to reopen. What are your thoughts on social distancing, continuing that, and the importance of it?
So it is important because I can't think of a better explanation for why the plateauing occurred after an initial period of what looked like pretty exponential rise. So in essence, it's not a foolproof thing. It's not like you're making COVID disappear. But when you initiate these distancing policies, again, on a community-wide level, the expectation or the hope is that you plateau and then at some point you begin to decline. As we are ramping up again for more clinical care, people will find that for our established patients that things are going to be different at Roswell compared to the way it was a number of months ago. You're going to find for one that our staff will be having masks. That's for their own protection, but even more so to protect others, because we do realize that it's that some people may have no symptoms and yet be able to shed virus and transmit to others. So the masks are one order of protection that we instituted pretty early. Pretty early in the course of COVID becoming a part of our community. We also provide our patients with masks as well. Within the waiting rooms for established patients, you might remember waiting rooms that are filled with people and kind of close together. We need to maintain that physical distancing, so there will be more space between people. On a workflow basis, we're doing our best to protect our own staff so that there's physical distancing between them, and as well to protect patients as well. Hand cleansers are all over the place. We're also really ramping up our ability to test, and we're expanding that ability as we get more test supplies. That's a nationwide limitation in terms of having the swabs and just everything that you need for testing. So far, we've increased our testing of both symptomatic but also asymptomatic patients, specific asymptomatic patients, such as those who will be undergoing transplant or surgery, to protect ourselves further and to diagnose COVID at with very early signs of infection or even no signs at all. To the extent that we can, we're going to expand our testing to more asymptomatic people who are undergoing therapy. And by doing that, our rate of actually detecting COVID would probably be extremely low, maybe 1 in 100, maybe less, but it's worth to do it so we find that one and we institute the appropriate precautions.
At a very important time, Dr. Siegel, thank you so much for what you're doing in this time today. I appreciate it.
My pleasure.
One of the biggest facets of the pandemic that took a bit to get off the ground nationally was testing. That included everything from procuring kits to ensuring equipment was compatible to process tests. To give us an update on Roswell's testing, we're joined by Dr. Charles LeVay. He is the chair of the Department of Pathology and Laboratory Medicine at Roswell Park. Dr. LeVay, thank you for the time. I do appreciate it.
Oh, thank you for inviting me.
And as I've said with everyone, I know it's an extremely busy time, but it is an important time to hear from folks like you. Where do we stand, sir, with testing as we sit here today?
So testing is fully operational. We can perform about 100 to 150 tests per day, and we have those results back within 24 hours. So that's where we stand right now.
That's remarkable. I mean, it's very quick. In 24 hours, I was going to ask you, for patients and staff, the results are back that quickly?
Yes, for both patients and staff.
So you talked a little bit about reliability. Can you get into that a little bit more in detail? How reliable is this testing for the folks that are undergoing it?
The sensitivity of this test was shown to be very, very high by a study from the New York State Department of Health. In the study, they looked at patients that presented that actually had COVID-19 and had presented to their primary care physicians and had specimens obtained from this nasal swab method. Then these samples were put on the same assay that we use at Roswell and the same assays used at the New York State Department of Health. And when they did the study, they found that 91 of the 93 of these patients were identified as positive by this PCR assay. So that corresponds to a sensitivity of 98%. So that's very, very high. So as you can see, the study really kind of proved that this is a very reliable test, and it's also a very sensitive test, as we discussed in the previous question.
Well, reliable is obviously good news. Testing is really our way out of this, right? At
Yes.
least it's the path to the way out.
Yeah, we need to test, identify the people and the contacts, and have them isolated.
Dr. LeVay, I mean, people that are coming into Roswell Park and people who are working in the confines of Roswell Park, it's important to all of them and all of us to know that we're safe. Talk to me about how testing can make people feel more comfortable inside Roswell Park.
All this discussion about the specificity and sensitivity of a test is very technical. I understand that, but the bottom line is that we have great tests. We can identify who has the disease, who doesn't have the disease, and we can create a safe environment for patients when they come to Roswell Park for their treatments.
Dr. LeVay, thank you so much for your time and expertise. I appreciate all you're doing at Roswell.
It's my pleasure.
Dr. Charles LeVay, he is the chairman of the Department of Pathology and Laboratory Medicine at Roswell Park Comprehensive Cancer Center.
These are challenging times, and staying safe at home is the right thing to do. But what if you're diagnosed with cancer? Cancer doesn't care about social distancing and won't wait until this crisis is over. Whether seeking a first appointment or currently receiving treatment, it's important to have a plan. Please call Roswell Park and let our doctors help you decide if you can wait or if you need immediate care. We're doing everything to keep Roswell Park a safe place to receive your cancer care.
COVID-19, cancer, and what's next? One final aspect we'd like to touch upon is the topic of mental health, which has come to the forefront as so many individuals continue socially distancing themselves, aren't seeing friends or family in person, and may be feeling isolated. We're now speaking with Dr. Jennifer Heidman, medical psychologist with the Department of Psychology at Roswell Park Comprehensive Cancer Center. Dr. Heidman, thank you so much for your time. I appreciate it.
Thanks for having me.
Really a very important time for you and all of the professionals inside Roswell Park. And we're all amidst such uncertainty right now. Our mental health continues to, be a really important factor. And I would imagine inside Roswell Park, even much more so. How are you helping Roswell patients get through this?
Right. It is a very stressful time for all of us, but I would say that cancer patients going through treatment especially are in a very unique position. They're already dealing with something that is very anxiety producing. And now we've kind of got this extra layer of worry and fear on top of it. So yes, we're continuing to work with patients regularly, just like we always have. I continue to see patients on a daily basis, really, and helping them to navigate this. Many patients I'm hearing are, they've become much more acclimated to this over these last handful of weeks. And now I think we're starting to turn a bit of a different corner of what's next. And as restrictions might start to loosen up, what are the expectations for patients? And so, we're really just encouraging patients to continue to be in very close contact with your medical teams, to understand that your treatment is still very necessary, and to stay on track as much as you can. And they're going to guide you through the medical aspect of how to do this. But, a lot of our patients are really in kind of a unique position to navigate this because they already know what it's like to be sort of isolated. They know what it's like for a life-changing circumstance to stop them in their tracks in some ways. And so I'm actually seeing a lot of our patients have a certain level of resilience around this. They're used to having to consider not being able to go everywhere that they want to, and having various symptoms that they're dealing with that changes their energy and their ability to be around others. So I'm actually hearing from a lot of people that they're strangely prepared for this in a lot of ways, and they are used to this in some ways.
Pre-pandemic, these patients were already under a lot of stress and duress. So I think there's probably a lot of truth to what you say. What are some of the issues that you seem to be handling with some of these patients?
I would say at the beginning of this, there was a lot of anxiety around, just like everybody, what does this mean for me? Can I go out and see my friends? I'm really scared that I'm going to get sick, obviously. Our patients are compromised in a lot of ways, immunocompromised. And so, I think, again, there's been a lot of adjustment that's taken place in the last few weeks. And I think a lot of patients are now much more used to being at home and not really going out anywhere. But there's the same concerns of, my family members are still leaving the house, whether it's to go to work or to go to the grocery store, or maybe some younger children are not taking this quite as seriously as we are, and I worry about getting sick. So that continues to be a concern for our patients. So again, I really just encourage them to get in touch with their medical teams, and so they're very aware of where they can go and what the precautions should be. We have some patients who worry, should I be going into Roswell? Should I go in for my treatment? I feel like I shouldn't be going anywhere right now. And again, we really stress with them that it's important to come in and continue on your treatment regimen and to stay in close contact with your team. And they're going to guide you, what kind of schedule you should stay on. And then, beyond that, I think patients are having a lot of the same concerns that any of us are of what comes next. When can I go out again? I don't know that I can stand being in the house for any more time. And so we do a lot of work with patients around just managing that anxiety, managing the stress. A specific focus of mine with patients is mindfulness, and it's something that I find to be really helpful with patients. When we're kind of spiraling into the future of the what ifs and the fear, it's a way to really kind of bring ourselves back to the present and to just kind of, figure out what do we have control over today? How can I bring some peace into my day? How do I stay connected to others so that I can still feel like I have some social connection? And we work a lot around, how do you structure your day in a time when there's really no schedule and there's really, really fuzzy boundaries around your time? I think it's really important for patients to stay structured as much as they can, getting up at a certain time, getting out of bed and staying out of bed, getting dressed, and finding a few activities that you accomplish so that you feel like you have a bit of a structure. And again, reaching out to others, family, friends, through technology or however you can to keep that social connection going. I think it's super important.
I think one of the most stressful things that everyone in the general population is hearing lately is this new normal and what new normal will be. And none of us seem to really have a full grasp of that. But for someone who's dealing with the normal that is their cancer diagnosis, and then to add the uncertainty of what a new normal will be like on top of that, has to put a lot of weight on your resources.
Absolutely. You know, I think we're always talking with patients around what is my new normal going to be. And, you know, I would say as soon as patients hear that cancer diagnosis, their sense of normal is already uprooted. And so they're already on this journey of figuring out what is my life going to look like after cancer. And so you're right. I think just having this, you know, COVID-19 concern on top of it is just making things extra complicated for people. But in a lot of ways, it's a similar journey for what cancer patients are already on. And it's the same considerations of, I can't get too far into the future and worry about next year or 5 years. I have to kind of just get through this immediate time of treatment or getting through this pandemic, whatever it is. And I really only can control the immediate, and I can only kind of control what I can influence. And so it's interesting how it's almost like a parallel journey for a lot of our patients, that they're already on this journey of, life has been turned upside down, and this is kind of unrecognizable to me. But let's just kind of stay in the present and work through the immediate needs, and then we're going to figure this out. And I think that's a lot of the work that we do with patients is sort of building that trust and belief that they will get through this. And again, I see our patients in this unique position of already having a lot of this skill, of already having this knowledge of knowing what it's like to live in a lot of uncertainty.
Dr. Heidman, thank you so much for the time, and thank you for all you're doing at Roswell Park.
Absolutely. Thanks so much.
A big thanks to each of our experts for joining us today on this very important discussion. If you still have questions as it relates to COVID and cancer care, please visit roswellpark.org/coronavirus. It's continuously updated with new facts and information. Or you can give the center a call at 1-800-ROSWELL. We thank you for joining us as we all navigate this pandemic together. Have a great day.
These are challenging times, and staying safe at home is the right thing to do. But what if you're diagnosed with cancer? Cancer doesn't care about social distancing and won't wait until this crisis is over. Whether seeking a first appointment or currently receiving treatment, it's important to have a plan. Please call Roswell Park and let our doctors help you decide if you can wait or if you need immediate care. We're doing everything to keep Roswell Park a safe place to receive your cancer care.
If you are newly diagnosed or have symptoms associated with cancer, you may be risking your survival by delaying your care. I'm Dr. John Kane, and I want to reassure you that Roswell Park is a safe place for our patients. We urge you not to wait and to call today.